So good afternoon, everybody. My name is Vagan Zakarian. I am a lead software engineer at the Information Systems Agency of Armenia. And today I'd like to talk to you about the Armenian National Services Gateway and how we design citizen-centric digital services. Before I start, I'd like to introduce myself a bit more. So as I said, I'm a software engineer, but my passion of software engineering started actually at TUMO. I believe I was 12 at the time, and I started going to a bunch of workshops, mostly programming ones. And then fast forward a couple of years, I got a chance to join TUMO's actual product engineering team. And then fast forward another 5 years, and here I am at the Information Systems Agency. So what is Information Systems Agency? And we're basically a team of 100 people. This is our office and some of the team. We're based here in Yerevan, and our collective vision is to build, a trust-based e-society and e-economy. So in practice, what we do is we support government bodies and public agencies with standards, methods, and tools to help them deliver high-quality public transformation and public services for citizens. And we do this in 4 main domains of cooperation. And those domains are cybersecurity, data governance and interoperability, electronic identity, user experience, and service delivery. Well, now let's go into a bit to practical terms. Let's slide more. So I'm sure many of you have used public services. When I say public services, I mean things like getting a passport, applying for a driver's license, or starting a business. And sometimes navigating those public services can be really frustrating. It's because ministries do digitization in a siloed manner. Let's change the slide. What it means for a user is, let's imagine we have 4 ministries and we want to get some kind of a service. Just quickly go through them. So you start from the one service and then you go to the other, and the first one is digitized, and then you move on to the next one. You can do it a bit quicker. Go faster. The next one, and all of it is digitized, and then you move on to the other ministry, it's also digitized, and then at last stop. And then here you hit a blocker. So this one service from the last ministry isn't digitized. It means now you have to go to the office, take papers with you, sign, fill in applications, and run around. Our interviews with citizens showed that they don't even remember the first half. What they remember is the last part, when they had to run around, and that's what they remember their whole lives about that service. So how do we address those issues, and how do we solve them? Well, slide again. So I have to introduce a new concept called life events. So what are life events? Those are significant experiences in a person's life, when usually this is when you interact with the government and get public services. Next slide, please. So those are some examples of life events, like having a child, owning a car, starting a business, or getting a citizenship, etc., etc., etc. So what we do about those in Armenia? Well, we have a public administrations reform strategy, which was approved by the government. And our agency, in collaboration with the government, is doing and implementing a pilot program of 12 key life events. Those are the 4 you see on the screen. And when we do the reform, afterwards, and next slide, please. Afterwards, the system looks like something like this. Please, now we're just going to do the same again. So the citizen starts from the first service, then goes to the next, and then the next, and then the next. Stop. And the whole end-to-end experience is completely digitized, and it's smooth. And this is based on the digital architecture. Next slide, please. Which has a couple of components. And the first component is secure authentication, common sign-in portal. Next, please. The next one is the UI UX standards, which are user experience standards. This means that the user interface is intuitive, easy to understand. The texts are written in human language, and the actual interface is made for people with various backgrounds. Next slide, please. The whole process is secured by cybersecurity standards. Next slide. And of course, the data is interoperable between ministries and services, so there is no need to run around with paper from ministry to ministry. Okay, next slide. So now let's bring it all together. And I'd like to introduce the Armenian National Services Gateway. This is, we call this hartak, and hartak from translate from Armenian means platform. This is the platform where citizens meet the state. This is a one-stop shop for Armenian public services and a trusted source of information. Plus, for those live events, we have specific guides to guide our citizens through the experience. Now let's do a quick demo. So as you can see, this is the interface of hartak. Now we see all the 12 live events that I was talking about. This one is childbirth. We go in. The content here starts from the moment you get to your first screening to the moment you go and register your child in the school. And we have small question and answer blocks to make the content easily digestible for our citizens. And anywhere you see the blue button, which says start, it's an active link to a public service. In this platform, we also use the rating system, as you can see down there, which is based on the CSAT. And the same experience to rate the content also exists for the services to rate your entire experience. Now, let's narrow this down. So I talked about the reform. Now it's time to understand in practice what those reforms or live events look like. So as the first reform, we started with the birth of a child live event. And we collaborated with 3 ministries. Those are Ministry of Health, Ministry of Justice, and Ministry of Labor and Social Affairs. And I here have to give a big shout out to Mr. Narek Mukherjee because he and his team are leading the reform. So what we've done with them is we sat down with the ministries and we did a discovery stage where we went and talked with parents. We went and talked in the hospitals and we understood the whole emotional journey that the user goes through. And what we find out is that it's really frustrating for the fathers to go through all the burden of taking a paper from one place and going to the other place, and it ruins the whole experience. So I don't remember if there was a father they didn't complain about this. Almost everyone said, I remember this one thing, which is I had to take this paper from hospital to polyclinic. So we picked this exact issue and we focused on this and we tried to solve it. So what we did is we sat down with all the ministries and we went back to the drawing board. We drew the entire flow. And what is it basically is 3 key services. First one, you have to get a birth certificate for the child. And then you have to register your kid in the hospital. And then the last thing is to get a one-time child benefit. Currently, this process takes anywhere from 2 to 3 days. Collectively, this is years. If you think about it, this is years of lost effort. I'm not even talking about the emotional impact it has on all of us. So we designed, and now the new service is able to do the same in less than 100 seconds. So before I do the demo, let's imagine all of us are in hospital and we just had a child. And now it's time to register. Next, please. So what happens is that you go to hartak, you log in through the secure login portal, and you're presented with this interface. You check your information about your kid and hit start. Now you fill in the contact information. This is going to be used to send the birth certificate and status updates. Now it's time to pick the register address for the child. Now it's the fun part. We pick the name of the kid. So here we fill in. There's also an autocomplete just in case if there are any grammatical issues to fix. Now we hit next. And then we pick the surname. Now it's time to confirm the name. Next slide, please. Oh, okay, got a bit faster. Anyways, so what happened there is that we say, yeah, we want to get the one-time benefit. We pick who's going to get the benefit and then which bank. And then now we're picking the polyclinic. We pick the polyclinic. Now we pick the doctor. Then here we go. So now we just review all the information we filled in. And if you need to edit it, just edit it on the spot and you confirm. So what we just done is register a child in less than 97 seconds. In about 5-10 minutes, we will get a birth certificate on our email and 2 extra emails saying that, hey, your registration was confirmed and your benefit will be arriving soon. So you can experience the same by visiting hartak.am or scanning the QR. And I'd like to thank you for listening. And thanks for the invite.
Thank you. Thank you for an excellent presentation. Any questions? Yeah. Ani and first, I saw a bit there.
Thank you very much, Fahak, and that was great.
Thanks a lot.
How is this information disseminated to the population of Armenia? How is somebody sitting somewhere having a baby hearing about this?
Oh, tough question. So for now, if I understood your question correctly, for now we're still in the beta testing of this application. So yet it's kind of an internal thing. So now all of you are part of this private group who knows about this service. But pretty soon, I believe in like a couple of months, we will have this released and this will be advertised a lot. And hopefully this will help the fertility rate a bit too, because we simplify the process. Yes, hartak.am is complete. By the way, hartak.am is released. It's online. You guys can use it. And any feedback, it's really cool for us. Thanks.
Yeah, this is wonderful. It's going to be transformative. My question is a little different. With this kind of smooth and seamless digital transformation, interoperability, single source of data, the whole thing, do you anticipate being able to aggregate from that and do different kinds of analysis in terms of how services are used, where supports need to be, where policies might need to be changed?
Absolutely. So what we have in our standards are 4 key measurements to help us understand the user's experience. And those measurements are, I can just go through the measurements. So the first measurement is which pages are the most visited ones. And then we have what is the drop rate from the service. So like if someone gets to the 4th page and then drops out, that's a problem for us. It means something is off with that page. And then we have more and more information to collect in to analyze the whole process for the service, plus the CSAT, as I said, that's like an internationally established standard for validating the user's experience.
Let me just follow up because I think that's great in terms of continuously improving the system. My question was a little different. It's probably not for you, Vakan. It might be for the minister. That once this is working and the people are using it, there's going to be very interesting data and analytics that can come out that aren't about the system itself, but are about other issues of labor or other that cross ministries, where this could inform policy changes and strategies for the country as a whole.
Basically, this will be followed up by a law on public information systems that all data and documents will turn into data in registers. Currently, 40-50% of data are on paper in Excel forms, not available as a service. Therefore, all the data in the public sector will be available to all the public institutions, but through APIs, standardized APIs, and also to the private sector. Therefore, with your identity, you can ask any data the public sector stores about you with the tourism agency, for example, to design your tourism package. This information is not accessible. This will be accessible through APIs against certain standards. And the gateway is going to be the feedback mechanism, basically, as well, to listen to the general population and improve services on an ongoing basis.
Is this eventually going to connect to the medical records? And is there some consideration of selling Armenian data? I'm just wondering if you're thinking about that Because some countries have sold their health data and their other data for lots of studies. I was just wondering if that has come up at all.
Nope. Nope. That's a misleading announcement.